My name is Dr. James Oigo Mokoro. I'm the chairman of Kenya Association of Pharmaceutical Industry.
I'm Steve Kipkoti, the current chair representing MEDAK, the Medical Technology Industry Association of Kenya. And together we've been collaborating on an initiative, first of its kind for both of us, to bring together two strong industry associations in the healthcare space.
Dynamics of regulations are changing quite fast. And now that our regulator Pharmacy and Poisons Board is gearing towards maturity level 3, WHO maturity level 3, we are here now to look at all the guidelines, benchmark with WHO, World Health Organization guidelines, which we have heavily borrowed in developing the local guidelines.
The workshop is so timely because the changes such as the inclusion or the affiliation for medical devices to the IMDRF is something that I feel our stakeholders would want to have information on and that we have been able to share during this meeting. I've also had a wonderful session on expounding on the EU regulation and how that impacts our market. And in fact, it's not just the European Union, but also the US FDA and other jurisdictions. This is a very timely workshop that I believe the regulator and the stakeholders coming together to address key matters enhances and elevates the discussion points that we are able to move forward in regulatory practice.
This training will have an impact in the industry, especially in the medical device industry, as it's a new, let's say it is a new device regulation in Kenya also and all over the world actually. So I think bringing such kind of trainings and learning about reliance will bring in a lot of, let's say, access for the Kenyans to get to know about what's happening in other regulated countries.
The need for this event has been timely but overdue at the same time. We've been having a lot of regulatory evolutions in the landscape, and then also with good regulatory practices on the forefront on evolution for ML3 enhancement with the Pharmacy and Poisons Board. We are both in a space where regulations are happening or being developed at a very rapid pace, and us as stakeholders do not want to be left behind. Now, at the same time, we understand that no one has a monopoly on good practices. For indeed, in our space, we call ourselves qualified, but we're all practicing. And together with the regulators, they are practicing, but indeed, there's capacity that's needed to be enhanced. So together on this side, we see ourselves, both MEDAK and KAPI, as allies to bring together our stakeholders and to put together points of confluence and convergence that touch us both.
Our role in universal health coverage is to make the product be available. Is it accessible? We need to make it very accessible and so that it is able to reach even our rural areas, because most of our patients also in the rural areas are not able to travel all the way to access these complex molecules in Nairobi. So we want to make sure that we work with the government also to try and increase accessibility even to the rural areas.
Collaboration with international regulatory authorities is going to ensure that we have reliance practices that are already adopted elsewhere coming and being utilized here, saving on resources, ensuring that we have human capacity that is going to be able to do, but also raising the capacity building for the National Regulatory Authority. I'm so grateful and I'm so proud that this is a moment that PPB is taking part in this workshop.